Here's a high-yield, 14-question NCLEX-style quiz covering critical, frequently tested topics. Each question includes rationale, test-taking strategies, and mnemonics to ensure you master the concepts. 1. Left-sided heart failure. A nurse is assessing a patient with left-sided heart failure. Which symptom is most concerning? A. Jugular vein distension. B. Peripheral edema. C. Pulmonary crackles. D. Hepatomegaly. Correct answer. C. Pulmonary crackles. Why? Left-sided heart failure causes fluid backup in the lungs, leading to crackles and dyspnea. Mnemonic. Left equals lung issues. Pulmonary congestion, crackles, dyspnea. 2. Priority intervention for myocardial infarction, MI. A patient is admitted with crushing chest pain radiating to the left arm and jaw. What is the priority intervention? A. Obtain a 12-lead ECG. B. Administer aspirin. C. Apply oxygen. D. Start an IV line. Correct answer. B. Administer aspirin. Why? Aspirin prevents clot progression, reducing further myocardial damage. Mnemonic, M-O-N-A, morphine, oxygen, nitroglycerin, aspirin, first. 3. Digoxin toxicity, key symptom. A nurse is caring for a patient on digoxin. Which finding suggests toxicity? A. Increased heart rate. B. Nausea and vomiting. C. Hypertension. D. Dry skin. Correct answer. B. Nausea and vomiting. Why? Early signs of digoxin toxicity include nausea, vomiting, and visual disturbances. Yellow halos. Mnemonic. Dig sees green. Blurred vision and nausea equals toxicity. 4th. Warfarin, Coumadin. Monitoring. Which lab value is essential for monitoring warfarin therapy? A. APTT. B. INR. C. Platelet count. D. White blood cell count. Correct answer. B. INR. Why? INR ensures therapeutic anticoagulation. Goal 2.0 to 3.0. Mnemonic. Warfarin uses INR. 5. Furosemide, Lasix, and electrolytes. A patient taking furosemide should be monitored for which electrolyte imbalance? A. Hyperkalemia. B. Hypokalemia. C. Hypercalcemia. D. Hypermagnesemia. Correct answer. B. Hypokalemia. Why? Furosemide is a potassium-wasting diuretic, increasing risk of low potassium K+. Mnemonic. Lasix loses K+. 6. Asthma medication use. Which statement by an asthma patient using albuterol requires correction? A. I use this when I have trouble breathing. B. I should rinse my mouth after using this inhaler. C. I use this inhaler every day to prevent attacks. D. I carry this inhaler with me at all times. Correct answer. C. I use this inhaler every day to prevent attacks. Why? Albuterol is a rescue inhaler, not a daily controller. Mnemonic. Albuterol equals A for acute attacks. 7th, COPD oxygen administration. A patient with COPD is on oxygen therapy. Which finding requires immediate intervention? A. Oxygen saturation of 92%. B. Respiratory rate of 10 breaths per minute. C. Barrel chest appearance. D. Clubbed fingers. Correct answer. B. Respiratory rate of 10 breaths per minute. Why? Too much oxygen suppresses COPD patients' respiratory drive. Mnemonic. COPD, low O2, slow R equals trouble. 8. DKA, diabetic ketoacidosis. Priority treatment. A patient with DKA is admitted. What is the priority intervention? A. Administer 4 units of insulin. B. Give oral fluids. C. Monitor blood glucose every 6 hours. D. Provide a high-carb snack. Correct answer. A. Administer IV insulin. Why? Insulin corrects hyperglycemia and stops ketone production. Mnemonic. DKA equals dehydration, K plus shifts, acidosis, fix with fluids plus insulin. 9. Hypoglycemia symptoms, which is a classic sign of hypoglycemia. A. Dry skin. B. Blurred vision. C. Cool, clammy skin. D. Increased thirst. Correct answer. C. Cool, clammy skin. Mnemonic. Cold and clammy unless you need some candy. 10th. Acute kidney injury. Lab finding. Which lab results suggest acute kidney injury AKI? A. Low creatinine. B. Decreased potassium. C. Elevated BUN and creatinine. D. Low sodium. Correct answer. C. Elevated BUN and creatinine. Why? AKI leads to waste buildup, increasing BUN and creatinine. 11th. Increased ICP sign. A patient with a head injury has Cushing's triad. What is a key finding? A. Hypotension. B. Bradycardia. C. Tachypnea. D. Hyperthermia. Correct answer. B. Bradycardia. Why? Cushing's triad equals high blood pressure, low heart rate, irregular breathing. Mnemonic. High pressure, low pulse. 12th. Eclampsia, first action. A pregnant woman has seizures due to eclampsia. What is the priority action? A. Check fetal heart rate. B. Administer magnesium sulfate. C. Turn the patient supine. D. Give oxygen via nasal cannula. Correct answer. B. Administer magnesium sulfate. Why? Magnesium sulfate prevents further seizures. Mnemonic. Eclampsia equals emergency equals magnesium. 13th. Preeclampsia. Warning sign. Which finding in a pregnant woman with preeclampsia is most concerning? A. Swelling in the feet. B. Headache and vision changes. C. Mild proteinuria. D. Heartburn after meals. Correct answer. B. Headache and vision changes. Why? This signals severe preeclampsia and risk of seizures. 14. Serotonin syndrome, red flag. Which symptom in a patient on SSRIs, e.g. fluoxetine, suggests serotonin syndrome? A. Muscle rigidity and fever. B. Increased appetite. C. Bradycardia. D. Dry mouth. Correct answer. A. Muscle rigidity and fever. Why? Serotonin syndrome causes hyperactivity, high HRBP temp. Thank you for joining this session on 14 uncommon NCLEX medications. Good luck with your studies, and I hope this review helps you feel more confident heading into your exam. Until next time, keep learning and stay inspired.